So, I'm very happy and proud to have you here, Professor Sugarman, from New York State, Rochester Institute of Technology. You are the clinical professor for pediatrics at the School of Medicine and Dentistry, but also what not, at least here in Europe, it's not a usual combination. You're also a researcher in psychophysiology. And we just, before the camera was on, we have been speaking that we are not to have to be perfect as therapists, and we are teaching this to our clients and to the children. And so I thought I start to demonstrate it with my tie.
Yes.
And maybe it's interesting to start to ask you for examples where symptoms of children can be a solution, where problems can be transformed into a resource, or handicap can suddenly be a strength in therapy or life. And this would help me to bring my tie in a normal position.
I think in your question, how symptoms can become solutions, or how problems or deficits, or a word I find difficult to say, disability, I'd rather say diffability. I think implied in that is like all dichotomies, a false dichotomy. That, of course, they're both in the same, that the symptom is always a solution, that what can be seen as an impairment or a challenge is a lesson and evokes abilities within the person. As a matter of fact, what gets labeled as their challenging behaviors or restrictive, repetitive behaviors are often their best efforts to self-regulate. And so they are attempting to modulate sympathetic tone effectively, and sometimes that's socially maladaptive or not understood or seen by others as a challenge or a disability. And the reason that's so important is because tend to approach those by saying, well, you need to stop. We need to fix, we have to give you something better to do. You need to stop doing that because it's disruptive or it's socially maladaptive, as compared to recognizing that it's a talent, it's a resource. So how can you use that talent and resource to move forward, to be more socially adaptive? One last piece about that is that I also think about labels as lessons. So a young person who comes in with a migraine, or with a manifestation of anxiety or irritable bowel syndrome, it's not whether that diagnosis fits, it's what that problem is attempting to teach that person about what they need to do. Clearly getting signals from their system that that this is what I have to do to adapt. But if it's a painful symptom, if it's challenging, if for people with autism it's socially maladaptive and therefore creates social problems in its use, then that's the challenge we get to play with, to transform.
So you are defining such symptom like migraine or stomach problems as like a control light in a car, and this control light is signaling we need more oil, or such as you are understanding it in this way?
Somewhat. Sometimes, yes, but when we get to a problem like autism spectrum disorder and the behavior is rocking, a really great way to increase vagal tone, or the symptom is something repetitive that feels good, then the problem that manifestation, that control light has, is on other people, not on the person who has it. And then it's a question of, well, this is very helpful. I'm thinking about this boy whose behavior, including rocking, included self-hugging. Lots of this. And his mother in my office said, like that, why do you do that? And he says, it feels good. You know, Mom, you should do it. Right? You should do it more. So then the issue is, how do you comfort yourself and how do you have a sense of competency and control and also drive forward in social behavior?
So you are teaching here about autism. Are there different forms of autism and different strategies?
So first of all, you know, this is not original with me. There's a common line that the single most salient feature of autism is its heterogeneity. Or the joke, if you've met one kid with autism, you've met one kid with autism. So I would first say that autism is defined as being more heterogeneous than people who don't have autism. I'm not an autism guy. It's just that autism became the perfect model for understanding the role of autonomic regulation in health and in behavior, really informed by both Ernest Rossi's work and focusing on utilization and autonomics, and strongly by Stephen Porges' work of understanding the vagal system of social engagement, and putting those together led to the notion that, well, maybe we can look at autism as a disorder of autonomic regulation or a difference in autonomic regulation. And instead of approaches that say, don't do that or stop that or let me teach you how we do it, I'm thinking in terms of embracing what they already know. And that's the Ericksonian approach of saying, you already have this wisdom and ability. Teach me how you do what you do, and let's find out how to do it better so that it isn't so much of a struggle.
You used this nice wordplay before with a diffability.
Yes.
With difficulties and disability.
Well, no, differences and disability.
Differences.
Yeah.
And
I didn't, you know, I thought I made it up, and then I Googled it, and a bunch of other people had made it up.
Mm-hmm.
And the issue is, disability defines the other's difference as a deficit, as an impairment. And since disability tends to be culturally defined, then this becomes a human rights issue. To say, well, because you can't operate in my world without some accommodation, you're less. And in many ways, diagnoses and labels diminish people, and in the worst case situation, they believe those limitations. Young people saying, well, I can't because of my ADHD, I can't because of my anxiety. My response is, really? What kind of person with that do you intend to be? So I think we need to look at these not just as a matter of social acceptance as differences, but to recognize, as we talked about before with symptoms as solutions, that these differences cause people to develop strengths. All you have to do is listen to Ray Charles, who lost his vision, but nobody could sing like Ray Charles. Or listen for visual imagery in Stevie Wonder songs. There's not a lot of visual imagery, but there's a whole lot of imagery. So certainly we have famous artists with impairments that drove their art, but I think that's true for everybody. As a matter of fact, I'll go further. Without question, especially as you read through the American Healer book about Milton Erickson, clearly Milton Erickson was a strange person with looking at people differently. And he used that difference. You know, Betty Alice is quoted as, you know, you couldn't get a straight answer out of my father for anything. So maybe we can look at it's not an impairment. It's a different view. These young people I'm seeing with autism may be better than Milton Erickson as they move through. I know lots of young people who've gone into social service and psychiatry and psychology work who come from a background that meets autism spectrum disorder and are gifted because they've had to struggle to understand other people. So I call it, I think in terms of diffability as a way of honoring that.